Welcome to the Affirming Minds podcast, where we equip like-minded mental health professionals with a therapeutic toolkit that helps add to a more engaging, fulfilled, and effective mental health practice. Each empowering episode can stand alone as a continuing education pod course or a very valuable professional or personal resource with insightful expert interviews, practical resources, industry news, and lots of inspiration. We help the modern therapist thrive at work. Now let's welcome your host, a dedicated therapist and passionate educator, Shaina, LCSW.
Welcome to the Affirming Minds podcast. I'm your host, Shaina. If you want to earn continuing education credit for listening to today's episode, consider becoming an AFFIRM Academy member. Visit affirmmentalhealth.com to learn more and join our community. A quick note before we get started, this podcast is for educational purposes only. The information shared today is not a substitute for clinical training or treatment and should not be used to diagnose or treat any individual. If you or someone you know needs mental health support, please reach out to a licensed mental health professional. We deeply value and respect client confidentiality. No identifying information about clients is ever shared. Any scenarios or examples mentioned are composites, de-identified, or hypothetical, provided solely to enhance your understanding of today's topic. Now, let's get into today's topic. Artificial intelligence is transforming nearly every aspect of our lives, and mental health care is no exception. While AI presents exciting possibilities for expanding access to care, streamlining administrative tasks, and even improving diagnostic accuracy, it also raises important ethical and practical concerns. Issues like bias in AI algorithms, data privacy, environmental impacts, and the potential for over-reliance on technology are all huge issues we need to be aware of in the field. To help us unpack these complex issues, I'm joined today by an expert in trauma treatment and behavioral health education, Alexis Cate, LCSW, and EMDR-CT. Alexis is a clinical social worker and certified EMDR therapist with extensive experience working in hospital and community-based settings across New York City. She specializes in trauma treatment and how early traumatic experiences shape the development of PTSD, mood and anxiety disorders, personality disorders, and substance use disorders later in life. Her work has been dedicated to supporting underserved communities, particularly adolescents, young adults, and their families. Beyond her clinical practice, Alexis is also a passionate educator in behavioral health and psychosocial wellness. She designs and delivers comprehensive courses for both professionals and students, bridging theory and practice to ensure that learners walk away with practical, applicable skills. Her approach is deeply compassionate, and she is committed to empowering the individuals, families, and professionals she works with. Today, we'll be diving into AI's role in mental health care, both its promise and its pitfalls. We'll explore how clinicians can integrate AI tools responsibly while maintaining ethical standards and human connection. And we'll also discuss its implications for accessibility, environmental impact, including climate change, and the future of mental health care. Let's dive in.
All right.
Alexis, thank you so much for being here on the Affirming Minds podcast. I'm so excited to get into this conversation today. I think AI is top of mind for so many of us. We're seeing it more integrated into the technology that we were already using, even in our social lives. It's becoming more a part of our daily practice of navigating day-to-day activities. And it's so interesting to hear what space this is going to occupy in mental health and some of the concerns and issues raised and some of the opportunities available. Maybe you could just start by introducing yourself to our audience, maybe telling us how you came to have an interest in AI and mental health care.
Absolutely. Thank you so much for having me. I'm really happy to be here. So, my name is Alexis Cate, and I'm a clinical social worker. I'm also a certified EMDR therapist, and I'm based in New York City. And I've been providing care to children, teens, young adults, and families for over a decade now, mainly in the Bronx, New York. I recently founded my private practice and consulting business, empowered psychotherapy in 2024. I've been providing consultation to therapists and also within New York City schools and agencies. I've done a lot of writing on the field across a variety of different topics. And so, really, over the past year, I've become more and more invested in how artificial intelligence, AI for short, is going to be playing a role in healthcare, what that will look like, and specifically how it'll impact mental health care.
Fantastic. So I'm sure that people are coming to this episode with varying levels of exposure. So maybe just as a starting point, can you define artificial intelligence for our audience members who may be less familiar? And how would you describe its current role in mental health care?
Absolutely. So, AI has become really this cornerstone of itself in our digital age. And AI, really, to put it simply, technology that enables computers and machines to simulate human intelligence and problem solving. So, from the recent global pandemic, it was really shown how our healthcare system is really starting to find itself challenged to both improve performance in terms of delivering effective and high quality care, while also transforming care by integrating technology more readily. The pandemic also highlighted the shortages that we have in the healthcare workforce and also definitely contributed to the increase in those shortages overall. I think the other piece to it as well is how it also showed the vast inequities in access to care. And it appears that AI is that next frontier to innovate and transform healthcare delivery. Globally, mental health concerns are at an all-time high and completely exacerbated by the pandemic that we just recently came out of. And so the implementation of AI technology is becoming ever more present in mental health care. And the role of AI is playing both on the side of how can it support clients and also on the side of how it can support practitioners. So there's a vast number of different AI applications and websites that are really dedicated to making therapist documentation and billing more seamless. And on the client side, we find AI being integrated into electronic health records, and there's an influx of therapy chatbots that are out there that are being developed and offering quote unquote free and low cost therapeutic insights. So I'm excited for us to get into that more.
Yeah, absolutely. And I think there is such excitement in terms of the opportunity around access issues. I think anybody who's worked in community mental health, anybody who's actually tried to navigate it, getting their own therapy or mental health care, knows that there are just these huge challenges. It is not an easy system to navigate. There are more people in need of care than there are providers. And particularly when we think about certain geographical locations and getting access. So this idea of supplementing the clinical providers with these tools has just sounds like so much possibility. And I have heard this resistance, especially when we understand AI as replicating some human decision making, that I think there's a lot of protectiveness amongst therapists and mental health providers, that this is such a humanistic, relational profession, and the concern about AI technologies encroaching in a way that can be damaging, problematic, hurtful, and maybe also just the threat of not wanting the things that are deeply important to us in terms of our role to be replaced, not feeling this can be outsourced completely to AI. So I'm curious for you in terms of, you already talked about chatbots and how this is actually in a lot of spaces, a lot of the AI that's being used, and this is how I have been integrating it, is actually for like administrative support for clinicians. But I'm curious what you think are some of the most promising AI driven tools available to mental health professionals holding in mind some of those concerns or outcries that it might be coming from the mental health community.
Absolutely. And I 100% agree that there is such a fear of that dehumanization in terms of therapy. When it comes to these AI applications and websites that really market making a therapist's life easier, ultimately, these sites and apps are built to, I'll break it down in terms of what I've seen and what I've experienced. If a therapist is using it in real time with their client, the idea is that the therapy session is being recorded on a secure HIPAA compliant format and then translated into a therapist progress note and also fellow documentation like a treatment plan. And for those of us that have worked in community health, we know how ridiculous the paperwork can be, quite frankly, and how overwhelming and how taxing it can be. So, some of the platforms that really can support us are ones that are recording sessions in real time with client consent. We'll get into informed consent in a little bit as well, and populating these progress notes and lifting that burden of documentation for a therapist is also a huge benefit to clients. Therapists can focus on their work with clients more intentionally without having that constant worry of paperwork piling up behind the scenes. And I have personally used an AI platform with informed consent by my clients, and it has done wonders for me. However, we also must ensure that clients' informed consent for AI use in their therapeutic care is at the forefront of our minds, and for therapists to also ensure that whatever AI is generating, that there's accuracy there and that it does truly reflect what the client expressed throughout the therapy session. So I always practice informed consent and reviewing what is generating, making necessary edits, because ultimately we also don't want to err on this side of assuming that AI is completely accurate.
Yeah, absolutely. Yeah, I think that idea that it generates content for you, it could be like, great, my note is done. Let's move on to the next thing. And that human oversight and really self-auditing, making sure that we're not going into the space of anything that is fraudulent, communicating that we have done an intervention that we haven't done. But something that I think in terms of the different documentation support, I've seen two sort of main ways that it's done. Some is this summary that you can do either through transcription, like audibly transcribing a summary of the session or writing a summary, and then it will generate content, or as you described, that direct patient recording in which the session is recorded and then a note is generated, which I imagine there's an accuracy that is happening with the recording in terms of truly reflecting the fidelity, the patient's response, because we are getting that recorded content. And I imagine the consent for that sort of recorded session really has to speak to some things about data storage and data security, the limitations of data security. Is there anything that you think that clinicians should be thinking about? I'm sure that these tech programs are launching everywhere. They're coming up and bursting, and you can't even keep track of them anymore. Are there things that clinicians should be thinking about when picking a platform to utilize in the space of AI in terms of client protections and thinking about what needs to be in informed consent that is important to you?
Absolutely. I believe that for us to really be able to trust in AI and use it intentionally, there also is on part of us as therapists that are thinking of integrating it. It is our calling to go to these websites ourselves and to do our diligent research on how their data is being stored, where it's being stored, how it is being collected, and the trueness of what it claims to discard these recordings and whether or not the platform is actually HIPAA compliant. I do think that there needs to be reassurances and evidence of safety measures put in place in order to keep our clients' information as private as possible. we have seen the negative effects of data breaches that can have on people. And the same is true for mental health care. And this really does go along with the potential lack of, I guess I'll call it transparency. Many of us are curious and would be curious as to how AI is actually reputable and how it's coming to its conclusions in a thoughtful way. So, if companies do not afford that transparency in how AI is generating its responses and the tools that it's utilizing in terms of ensuring that it is outputting accurate, intentional, and well informed data on its end, then consumers are really ultimately going to be hard pressed, I believe, in allowing AI to be utilized in their care. And so for AI to be ethical, practitioners, electronic health records, insurance companies really must ensure that every single client is giving informed consent and also consider the options for consumers that do not want AI to be a part of their care at all, because that is their right, ultimately and absolute.
Yeah, absolutely. And I think just in terms of the application of this, because it is so sensitive and because even if we're doing our due diligence and really researching, there is like a whole industry around like data collection and that there's so much that we have control of, even if we're using HIPAA compliant platforms. As you mentioned, there have been breaches to HIPAA compliant platforms before. It's always a risk that we need to be communicating to our clients. But I think also this being in your consent form is crucial, but I also think insufficient, right? So especially if you're going to be recording sessions, like actually talking to clients and explaining the benefits and why there might be value to them, but also the risks involved, and really giving them an opportunity to opt out if it feels like it's going to inhibit their ability to be open in treatment at all, if it's just not something they're comfortable with. I think, of course, I probably should be better at thoroughly going through any papers I sign when I'm at a doctor's office, but sometimes we're brushing through it. And I think this is something too sensitive to not reinforce with a verbal communication.
Absolutely. I one thing that I do practice with my clients that have provided me the consent, in terms of informed consent on my side, it's not just simply sending a consent form to be signed. I talk my clients through exactly what the AI application is, what I have found in terms of its reputability and its ability to keep their data safe. And I give them all of that information. I talk it through with them, and if they do decide to sign the consent form in terms of having it be a part of their care, great. However, I always, every single time I meet with the client, ensure that they are comfortable with the session being recorded for AI purposes and my progress note on the back end. Because there may be certain topics that they're not going to want recorded in any way, space, or form, even if they have given prior consent. So I think informed consent does go just beyond the paperwork side. It really is an ongoing conversation for us to have and to be mindful of.
Absolutely. And to your point about using HIPAA compliant platforms, I think probably one of the most utilized AI platforms right now is ChatGPT. So I have heard in spaces people saying that they're using it for treatment planning and things like that. And I would just say, as of now, at the time of this recording, January 2025, ChatGPT is not a HIPAA compliant platform. So you're taking an incredible risk, even if you're not putting PHI ChatGPT as a search. There might be different ways that you might think about using ChatGPT to enhance your clinical care, but anything that's going to live in the record, even if you're being very careful and discerning, I think just as clinicians and safeguarding our own practices and licensure, we need to really be wary and be thinking about these things very thoroughly. One thing you mentioned, Alexis, is that one of the greatest potentials of AI is accessibility and how this can help us care for underserved populations, potentially marginalized populations. How do you see AI working either now or the potential in terms of improving access?
Absolutely. I think first is the affordability side. AI therapy chatbots are flexible and often free or low cost to consumers. And AI can be accessed at times that don't interfere necessarily with a person's schedule, does not take them away from their responsibilities, and also does not necessarily require them to travel. And so, with that flexibility, also comes the accessibility side. Certain areas of the world are more isolated. Certain careers do not allow people the time to receive support during a therapist's regular working hours, right? And so, person in these areas and circumstances can turn to AI for support. There may also be a benefit to address a person's stigma in terms of receiving help. Many online therapy platforms have now offered texting options to a client's therapist. And while AI does not have a real time person on the other end, it does provide that increased level of anonymity for people. Perhaps, and maybe allegedly, entrusting AI may feel easier at first than entrusting a real life therapist. Shame and guilt from our experiences are vast and all consuming. And so it may be easier to initiate those kind of discussions on an AI platform for a person to process before going to that next step of getting a therapist in real life.
Yeah, no, that's very interesting. And I have read about some of the work that the VA has done in integrating the use of AI. And I thought it was very interesting that veterans at high risk for PTSD often felt more comfortable talking to this AI avatar. Rather, the initial AI I'm thinking of was not to provide direct treatment. It was a assessment tool that monitors body language, nonverbals, like changes in like cadence of voice, and to be able to predict those subtle indicators that might indicate that someone was having some psychological suffering and might be at more risk for mental health condition. And I thought that was a very interesting piece for people that maybe like distrust and hypervigilance is built into their clinical presentation. This might be an access point if it does feel unsafe to really show up with a therapist at this time for fear of judgment or whatever else might be a limiting factor. Um, yeah, I think that's very interesting to think about. And of course, as you mentioned, like the cost, affordability, and reaching these more remote locations. I think this would be a really incomplete conversation if we didn't name and address the environmental impact of AI development. There are very legitimate concerns about the impact of AI on climate change. And I'm curious for you how you're thinking about how does the use of AI intersect with the ethical concerns overall of integrating AI into healthcare in the context of environmental justice and the environmental burden potentially?
Based on the research that I've done at every given moment is using a massive amount of energy. And I saw some research by a Yale University associate professor, Dr. Yao, and she discussed in her article how AI needs this large amount of hardware to do what it does. And the production and maintenance of this hardware alone, such as the AI servers, is adding to that overproduction of electronic waste and further polluting the environment. And unfortunately, although we have had electronics for decades now, there is still a substantial amount of electronic devices that are not being properly recycled. So, if healthcare and mental health care are going to integrate AI into electronic medical records, then the industry really does have a responsibility to ensure that the production and maintenance of these AI systems that are being integrated is utilizing renewable energy sources like solar and wind. And I would also add it being a duty for healthcare and mental health care to ensure that they are recycling outdated electronics appropriately and even to integrate that use of recycled hardware moving forward in the work that practitioners are doing, along with working with the developers of AI to create hardware that has a longer lasting lifespan in order to eventually reduce waste overall.
Absolutely. And when we were talking about choosing AI platforms, part of it is thinking about the ethical concerns in terms of data security, HIPAA compliance, patient protections, but perhaps also thinking about it is like, what is their environmental commitment in terms of utilization of AI? There are companies that are very clear and upfront and transparent about how they are considering the environmental impact and what they're doing to innovate to reduce the impact and what they are doing to reduce harm in the implementation of AI. If your practice, if your institution or you as a private practitioner are considering this and feeling like for whatever reason AI needs to be in your clinical practice or to supplement your clinical practice for the benefits that we've already been starting to mention, certainly something to consider very heavily and center. And I say this also as someone who historically with technology has been a late adopter. I'm always late to the party. I'm always like the last to know. And as AI has been emerging, and I think it was very, for many of us, it's been here. It's been very invisible. I think with the launch of things like ChatGPT, where we are having a more active use of it, we're more aware of it. But I think like I've been seeing this story be like replicated on social media about that ChatGPT uses like this 4 times as much energy as a Google search, and that's already an old statistic because now a Google searches generate an AI response. So it's like
Exactly. An AI overview.
we're all posting it on Instagram, which also has embedded AI all across the platform. So it's like the irony of people using AI platforms to say, don't use AI platforms. It's already here. It's already embedded in our culture in a way that, not that it's impossible, but I think it's going to be increasingly difficult to utilize zero AI in your life as services and companies you're already using are integrating it into either front end or back end parts of their services. So something to certainly think about for those late adopters. I think that I certainly understand that. And especially if you're not practicing independently, recognizing this might be something that becomes just part of practice and being able to do it in a way that feels ethical and aligned with your values to the extent you can control. I think it's something you should be informed at, even if at this point there is disinterest because of ethical climate concerns or other ethical concerns that may be coming up.
Absolutely. And that brings up a really good point in terms of AI's accuracy. AI has been around for quite some time. However, the research in terms of AI's accuracy in improving diagnosis and treatment outcomes is still very much in its infancy. There was one study that was published in 2024 by Weisenberger and his colleagues, and they had recruited adults via social media to engage in a very brief AI bot administered interview and a depression self-report on this app called AI Berry. And AI Berry utilizes language learning models, which analyzes text, audio, and video cues, as we had mentioned before, in terms of the work that veterans have been doing with AI. And during the AI bot administered interview, these cues were allegedly supporting AI in understanding the individual at a more personal level rather than simply just generating the same generic information for everyone. The study did find that 90% of AI diagnostic predictions either agreed with the consumer self-report or with the clinical expert's opinion. And while these results are promising, a study published in 2023 found, granted, we had said how ChatGPT is not a HIPAA compliant platform and is powered by OpenAI. Yet it rated the risk of suicidality for patients significantly lower than mental health professionals across various conditions. These results highlight how the use of ChatGPT is more often potentially going to provide inaccurate assessments that underestimate actual suicide risk when compared to trained mental health professionals. That is a huge concern for me as a practitioner. There are a lot of different factors to consider in this data as well, like we discussed, the AI system itself, its developers, and whether mental health practitioners are involved even in the development and tweaking of these algorithms. So we really do need more clarity about the who, the what, and the how behind these different systems in order to support the efficacy of it.
Yeah, absolutely. I think that's such a great point that there's just so much more to know and to understand, and also scrutinizing the funding sources for the research that we're seeing in any direction, like whether it be a positive or very critical, understanding the incentive behind these things are being looked at. And it sounds like part of it is just reinforcing that this is not a replacement, particularly now with the state of accuracy. It is a tool that should not supersede clinical judgment. So as being very busy clinicians, oftentimes we could delegate out. That can feel like it's a lift for us to get some time back and have more clinical space. We want to be thinking about the integration of this thoughtfully in a way where it's hopefully creating more space to hone in on safety issues and clinical judgment versus replacing those really critical components. Um, that it is promising to hear that there are some promising findings in terms of diagnostic accuracy, particularly because we know there is bias in human diagnosing, right? Like we see
Mhm.
this all the
Absolutely.
time that oftentimes people of color are given what may be considered more severe mental illness diagnoses than their white counterparts. So there's already ingrained biases diagnosing. So I think if we had more refined ways to check ourselves, because oftentimes our bias checks are self-implemented, that would be important. But I know we're going to be talking a bit more about biases in some of these AI algorithms, but yeah, just something that came to mind. Can you share a specific example of AI being used successfully in a clinical or therapeutic setting?
Absolutely. So I will give a anecdotal success story of a client that I did utilize an AI therapy chatbot platform and app. And so for confidentiality purposes, we will call this client Jenny. And I'll just give a little bit of context regarding Jenny. So Jenny is a 20-year-old Hispanic female, and she was originally born in Ecuador, and she migrated to the United States when she was 3 years old. And she is a permanent resident, and she also identifies as lesbian, and her pronouns are she, her. And so Jenny started treatment with me due to anxiety, which was exacerbated by failing her recent college semester. She has been held at a very high standard by her family, being first generation in this country and the first one in her family to ever go to college. And so Jenny had reported a lot of negative thoughts, such as, I'm a failure, I'm stupid, I'll never be anything. And based on my clinical observations, I did also note that she had a mildly depressed mood. And she had shared that throughout her life, mildly depressed and anxious symptoms had been coming up for her since she was a preteen. And yet at the same time, she had never doubted herself so significantly. She had always felt that she was able to really bounce back. And she also denied any history of suicidality and self harm. So coming into therapy services, she had supportive coping skills such as listening to music, she was exercising 4 times a week, and she was also a really talented painter, and that was something that really helped to soothe her. Yet, at the same time, she had started to find that these skills were really only slightly helping, and they had usually supported her in resolving any of the depressed or anxious symptoms that would come up and resolving them pretty rapidly. She also noted the feeling that she really had to push herself so much harder to do these things that she loves. And she really just found herself binge watching Netflix, which is just so out of character for her. So, in the beginning of our therapy, I started to take a cognitive behavioral approach because the self talk had just become so riddled with negative thoughts, and her behavior change was so drastic. After a few weeks, Jenny had shared that she was able to utilize the skills that we were discussing immediately following session. However, after another day or two, she just found it becoming more difficult, even with different handouts, writing the skills out for herself in this little therapy journal that she was keeping. She was really just having this overwhelming sense that she didn't feel anything was going to be able to help her long term. And so we turned to an AI app, and it is an app that is specifically designed to support cognitive behavioral strategies. And over time, the app provided Jenny an interactive space to be able to express her negative thoughts and feelings in the moment and work through the skills in that same moment as well that we had been doing in our work together. And so she reported that the app really started to support her in believing more readily throughout the week between our sessions that she was going to be able to get through this next semester of college. And she found the AI therapy chatbot provided reinforcement of the different cognitive skills that we had been reviewing repeatedly. She ultimately was able to regain that confidence. Her negative thoughts were reduced, and she did improve her academic performance the following semester. The next semester, she was able to get a 90 average. So, some of the things that I was really mindful of in deciding whether or not Jenny would be a good candidate for an AI therapy bot to be used adjunctively with our treatment. First was her history. She has always been resilient, and there has never been an instance for her of suicidal thoughts or self harm or psychosis. So, these factors taken together made her, in my professional opinion, a good candidate for AI to be an adjunctive support for us. Now, alternatively, if she had a history of suicidal thoughts, of self harm, of psychosis, if her symptoms were more to the moderate to severe level and really debilitating, I don't know how much confidence I would have in being able to entrust AI in moments of need. I think that, especially given the research that I've done and the difficulties in knowing whether AI will be supportive or not sometimes, I do think that it's a big risk to take to integrate it with certain populations that we support because of the fact that health and safety are always first and foremost for us as practitioners.
Yeah, absolutely. And I think considering the patient's internal resilience and coping skills, judgment, impulse control, all of those things. And I would think like also the relationship, because one of the concerns I've heard is what if I'm supplementing my treatment with a chat box and the guidance or skills that are generated through the chat box are counter to maybe some of the clinical work that we're doing. I think being able to, and I don't know how much that actually comes up in practice, that because obviously we're not doing advice giving, we're not being like necessarily controlling about clients' behaviors outside of sessions. But I definitely understand like, if you're operating within a certain clinical modality, I think particularly maybe people doing exposure work where they're trying to reduce avoidance behaviors and maybe having some supplementation service that might reinforce avoidance in the service of maybe stress management or relaxation or something like that. But I think understanding the clinical rapport and the trust that's established, and also how much the client understands the current treatment goals, getting a sense of what the treatment goals are, and if those things could providing caveats and nuance and context to things versus like maybe like blindly following whatever a chat box is recommending. And I think what you're describing too is so important because we had Jenny Ketchum-Crooks on this podcast who wrote a wonderful book about digital minimalism and bringing intentionality to phone use and our use of any sort of screens that are now so infused in our daily life, often are like extensions of ourselves in many ways. Leveraging something that is always with someone in terms of helping skills reinforcements and developing new habits, I think is something we really have to think about. Many of us, as part of our clinical practice, assign homework, but having people carrying around worksheets or notebooks and however we want that to be applied in real time, oftentimes is just not reasonable in terms of people's day-to-day lives. So having some of these tools that are continuously accessible to them and almost like habit stacking, like you don't have to teach someone to be checking their phone regularly when in distress. So I think I could see how that was incredibly valuable to use an app to supplement treatment for someone who already had quite a bit of buy-in and was very motivated. Yeah, that's wonderful to hear. I know that we talked about a lot of the ethical concerns surrounding use of AI and mental health, the environmental impact, the security issues, and maybe issues with accuracy and how that can translate to safety issues. Anything else that maybe we haven't named explicitly or talked through much that you feel like is a pretty prominent ethical concern in AI that clinicians should be thinking about?
I think for AI to be equitable, it must be free from biases and prejudices. And with our technology thus far, we have very much struggled to achieve that. So, if I may, I'd like to get into the algorithm side in terms of biases.
Yeah.
Okay, great. So, bias in technology has been evident since its inception. Humans hold bias, and as humans, we have created technology. So, technology is going to be infused with bias. This leads AI to ultimately exacerbate potentially existing healthcare disparities if it is not carefully implemented. So, this is really a task for AI developers in the mental health space to keep at the forefront of their minds. Algorithms that are trained on biased data can lead to those discriminatory outcomes that we had mentioned before, based on factors such as race, ethnicity, socioeconomic status, and that could definitely impact the diagnosis and the treatment decisions. So there's a few things that I have seen in the research that I think AI developers would really need to do in order to ensure that they are addressing the potential for biases. First being having diverse and representative data, implementing audits to detect biases that have potentially come up, ensuring the transparency with consumers in the decision-making process, actively monitoring AI for any and all biased outputs throughout its production, and of course, involving a diverse team in the development process of these platforms.
Yeah, no, it sounds like there's an opportunity. We talk a lot about, biases within mental health treatment, psychotherapy, and that a lot of these treatments were developed based on white westernized values of perceptions of mental illness, of recovery, what wellness and health is. So I think that risk of bias is incredible, but because we are not completely at its inception, but we're in early days of AI integration in healthcare, there is an incredible opportunity to not replicate the mistakes we've already made in terms of having diverse representation and voices and thinking about how to operationalize these products and services and data collection. It's a complicated time, I think, politically, as there's increasingly more pushback, aggressive pushback about DEI initiatives, while simultaneously an aggressive movement to enhance AI, particularly in the United States. My hope is that this moment of political transition and, in some ways, a lot of turmoil, we don't miss this opportunity to actually develop these critical tools in a way that's reflective of the people who will either be benefiting from them or potentially being harmed by them. I think it's such an important point. What are some risks that you see with over-reliance on AI mental health care, and how can clinicians mitigate that over-reliance?
Absolutely. And this ties into my perspective with respect to professionally how the current political climate is. And I think that clinicians ultimately, the field of psychiatry, psychology, we need to do better in general, especially at this point in time. In terms of over reliance on AI in mental health care, Bernard Marr wrote a really fabulous article for Forbes in 2023 that I feel encapsulated the concerns of over reliance on AI. And some of these over reliances have already been presenting concerns and how they may amplify these concerns because of AI's just really push into the mainstream. So he wrote about areas that I believe are so important for clinicians and clients to remain mindful of should A be a part of their work and their healing journey. So Marr had wrote about the concentration of power, bringing up the political climate, which is the risk of AI development being dominated by a small number of large corporations that could exacerbate the inequality and limit the diversity of AI applications. Encouraging that decentralization and collaborating AI development in DI is really key to avoiding a concentration of power. Over reliance on AI really could lead us to a loss of critical thinking. We've started to see this in academia, concerns popping up of AI ultimately writing papers for students, and AI assisted decision making is one thing. However, our ideas should still be representative of our own thought processes. AI also has the potential to lead to job loss. We talked about how AI is going to be integrated into electronic medical records and will often be used for billing of insurances. So, this would mean what happens to the persons that are doing billing right now? How would their jobs shift or be eliminated because of AI? Marr had also touched on economic inequality as AI disproportionately is benefiting the wealthy individuals and the corporations, just to add on to that centralization of power. As we talked about above, job loss for persons on the front lines due to this AI driven automation, it's more likely to grow that gap socioeconomically rather than bridge it. And we've already seen how social media has really hampered a person's ability to connect with others in real life. And so that increasing reliance on AI-driven communication can continue to lead us down that path of diminishing empathy, social skills, and human connections. And so to really preserve the essence of our social nature as humans, we really do need to strive in maintaining a balance between technology and human interaction. The last point I'll say is the capability of AI to promote misinformation.
Mm.
And what concerns me as a social worker, as a mother, as a person that has worked with underserved populations for the better part of a decade is powers that be can utilize AI platforms to support their agenda. And so that would ultimately mean that AI is contributing to a potential spread of false information and manipulation of public opinion. And that is startling.
Yeah. No, absolutely. Absolutely. Yeah. And I think that over reliance of blindly trusting the content that we're consuming when it is AI generated, really being able to fo- follow the sourcing, understand whether that be in the platforms themselves and the information dissemination itself. I think it's something really valuable to be an intentional consumer. But I think you're right, just on the collective structural levels, mm, the pace at which this is growing is really rapid, and that who is at the helm of those decision makings about where it goes and it feeling more and more concentrated. I think that is something in terms of advocacy is continuing to advocate for implementation that centers the well-being and health of our clients and the communities that we're serving is going to be incredibly important. And like just as you meant, like who it's also reaching, we know in terms of like one of the things COVID unearthed too is like an incredible digital divide. If you didn't have Wi-Fi, if you didn't have access to a tablet or a computer, if you weren't savvy and using those because you hadn't had a lot of experience, that might be the difference between getting healthcare or not getting healthcare, the difference between going to school or not going to school, working or not working. And I think having thinking about as this grows and the advantage that people who are just in terms of the pace of output that people who are utilizing this is also being thoughtful about the education of utilization, not just as mental health consumers, but just consumers in general, so that people don't get left behind and we continue to see. I think that was really important when you said that it's more difficult to bridge the gaps
Mm.
than when that we do. I imagine this potentially causing an incredibly widened gap in terms of understanding and exposure to these sorts of technologies.
Absolutely. I really appreciate this conversation because we are looking at both sides, right? And the fact that both sides, the benefits and the pitfalls of AI, as I like to call it, are simultaneously true,
Mhm.
right? And where's the middle ground? And so while there can be accessibility, there is also a high prevalence of inaccessibility that it can also cause. And what does that mean for persons that are not tech savvy, do not wish for technology to be a part of their treatment, a part of their care, do practice that digital minimalism, as you had mentioned before, right? What does that mean for them? And how do we ensure that we are continuing to put person first?
Yeah, absolutely. So, how do you see AI in mental health care evolving over the next few years? I know you have the dystopian sort of a sense of where it could go in a way that kind of feels harmful. But just in a more of an overview, where do you see AI going in healthcare maybe over the next decade, half decade or so?
I think in terms of where it's going to go is it will definitely be integrated into our electronic medical records, whether we like it or not.
Mhm.
I think that is just what's going to happen. And while that may reduce burnout for clinicians, practitioners, doctors, it also needs to be done in an intentional way. AI may offer the potential for earlier detection of mental health concerns emerging from what is called digital phenotyping. So, this is a type of AI integration where digital phenotyping accesses a variety of different information from a person. So, their health record, their wearable devices like an Apple Watch, their social media, and it would offer potentially a whole new layer of monitoring, especially for at a higher risk. And so it may also provide clients with some level of empowerment to take their care in their own hands, like we had mentioned before. Most machine learning allegedly adapts itself to the consumer in real time, which may offer that added layer of personalization for clients as well. Yet, I do also think that if we are going to be reducing the burnout for clinicians, practitioners, and doctors, that time should not be replaced with more for clinicians and doctors to be putting on their plate. That time that they would utilize to make sure that their documentation is completed should not be filled with another client for them to see, because that is just going to continue the revolving door of burnout, and it's not going to necessarily support in any way.
Yeah. No, absolutely. Absolutely. What skills or training do you think mental health professionals will need to be incorporating to work effectively with AI now and in the future?
I think collectively as clinicians, we do really need to think critically and ask ourselves certain questions about the efficacy of AI being in our work at all, if at all. It does not and will not be for everyone, nor should it have to be for everyone either. However, we do have to be realistic about the fact that a lot of the systems we utilize in our day to day life, AI is in the background. So we talked through informed consent, and that being one of my biggest concerns. If a client does not want AI to generate their progress notes, then a clinician must respect that and continue to do what they've been doing. Keeping up to date with the latest data and how AI is adapting culturally and in a racially attuned manner, getting mindful and doing our own research on companies that are marketing that they're using HIPAA compliance. So it's really packaging all of the stuff that we've talked about and putting it together and putting it into practice. So whether that means every 6 months or so, you're looking at the latest data that's coming out about an AI platform that you've been considering or that you've been using and seeing how it might be more culturally attuned or not, and just keeping ourselves really in a place of curiosity.
I think really important to do our independent research. If I had to make a prediction, I think the licensing boards are a little slow to adapt to this, but I do think over the next couple of years, it is going to be a required ongoing training for mental health providers to get best practices on AI, because this very conversation, maybe 2, 3 years down the line, may be totally irrelevant because things are evolving that quickly. So I think also leveraging your continuing education, whether again, you're all in, you're super excited, you're ready to take it all in, or you're very skeptical and hesitant. I think no matter where you fall on that spectrum, keeping yourself aware and educated, because as you mentioned, Alexis, I think that it being integrated into our electronic medical records likely will not be a choice over time. I think there are going to be very seldom options that are completely devoid of any AI integration. As a pretty slow adopter of things, I was pretty hesitant to even use work email when I first. I was like, "That wait, I'm talking to the person. They're right next door. Why wouldn't I just go knock on the door?" Or when I started my training, they still had. I'm not that old. I'm still pretty young, but we still had paper records,
Yeah,
handwritten
same.
notes. Just in our career, things have evolved quite quickly, and I think that's going to be a rapid acceleration that we're going to see. I think your points and encouragement of how to do this well are very important. Um, this was such a great conversation. I think your knowledge that you're bringing to it is so helpful to start to think about. So, would you tell us more about where our listeners can find you and learn more about the important work you're doing?
Absolutely. So I am not on social media in terms of my professional side of my life, and that is in a way purposeful. So my website, however, is www.empoweredpsychotherapy.org. And people are welcome. If they do go to my website, they can click the contact tab and subscribe to my mailing list. I also have behavioral health courses listed throughout my website, and my business email is empoweredpsychotherapy@gmail.com. So, because I'm not on any socials, I do welcome any practitioners or any persons out there that would like to connect with me on LinkedIn. You can search me by my name and my credentials. First name Alexis, last name is Cate, Cate, and my credentials are LCSW, EMDR-CT, and CASAC, CASAC.
Amazing. And we'll make sure to put that all in the show notes so it's super easy to find you, learn more about the important work you're doing. Our website's fantastic, lots of great trainings and blogs, and really covers a lot of different interesting, really highly relevant, timely topics in mental health. So you're really on the pulse of it, which is fantastic. Thank you so much for being here. And I loved our conversation.
Thank you so much for having me again. It was great being with you.
Thank you for joining our community on the Affirming Minds podcast. If you loved this episode as much as we did, please follow us wherever you listen to your podcasts and share it on your socials. If you want more information about how this podcast can add to your continuing education credits, visit affirmmentalhealth.com. And remember, let's affirm, heal, and grow together.